So, um, um, inshallah, this program is about the mental health awareness. And as I said, that we started this journey in the month of December. And since then, every month we are doing this program. And every month we are inviting a professional that can give more light onto the mental health awareness issues in our community. And they all are professionals from Austin, alhamdulillah, so far. And they bring in the perspective from their own speciality that we have, that we see in our community and what they see in their specialty. And we try to bring it under the context of mental health awareness, and also how Islam and the religion and focus and discipline can help in these challenges. And inshallah, you get an opportunity to talk one-on-one with the professionals of our community, where we won't even have this opportunity to talk to them or see them or hear them, or their side of view. And so this platform is meant for that. Inshallah, so this sessions are all recorded. They are on YouTube, our YouTube playlist. And inshallah, that basically brings us to introduction of our presenter today. That's Dr. Nudrat Khatri. She is a practicing at Lone Star, and she is my wife. And alhamdulillah, we'll give her an opportunity. She's taken the time to present us her view of how, what steps, what things that we need to look out, and when we can go out and seek help, and how do we approach our primary care. So inshallah, I'll hand it over to Dr. Nudrat Khatri, and she will take it over from here, inshallah. Assalamualaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh. A'udhu billahi minash shaitan rajim. Bismillahir rahmanir rahim. Assalamu alaikum to everyone who's attending. And I apologize for the technical difficulties that were there. I would like to start with introducing myself. I am Dr. Nudrat Khatri. I am one of the family practitioners and a geriatric provider here in Austin, since practicing for about 4.5 years. And alhamdulillah, I've been blessed with a beautiful community here that I get to practice in, a nonprofit organization called Lone Star Circle of Care. And I see a variety of people, from teenagers to the adults to the older adults, which is one of my specialties that I practice and I trained in. So I am a board certified family practitioner with additional certification in geriatric medicine. And that is what I do for my topic today. I would like to talk about depression, and for a little bit more about mental health in general, and how you can approach your primary care doctor about it. At the same time, what are the different things that we see in primary care that are related to mental health disorders, but keeping it to depression for the main part of it. And what is depression? What we define depression according to the DSM-5, or the Diagnostic and Statistical Manual of Mental Health Disorders, is a variety of symptoms that you can come across, which persist pretty much most of the days or every day of your life for at least 2 weeks. And then this could be a prolonged experience for more than 2 weeks, with a minimal duration of 2 weeks at least these symptoms are present for. And I would like to talk about each one of these symptoms specifically a little bit more. When we think about depression, we first think that it is just feeling sad, or a feeling of being empty or hopeless or helpless, or somebody who is just sad all the time, more tearful, irritable. But also there is another aspect of it where it could be just instability of your mood. You are very, very irritable. You were fine a few minutes or hours ago, and then you suddenly, the minute somebody talks to you, just do not want to hear them, don't want any sound around you, want to be left alone for a day, for just hours together without doing anything. And that is either a person themselves notices it, or somebody else comes and says, hey, what's wrong? You're just, not coming out of your room, not doing anything, just being there. And the if you were to show little interest or pleasure in something that you would do, for example, let's say a somebody who is working, who has a job and is a homemaker, is able to carry out all their activities and function as a parent absolutely fine, and suddenly they find themselves not able to complete their tasks, or they find like they just don't want to finish something. You're just procrastinating on things and not able to get things done. There may be something going on deep down, and you're not able to achieve it because of something that is going underneath, and that may be something to talk about. Or for example, you loved art, you loved listening to um, some specific lectures or a particular field of interest, and suddenly you notice that that is not happening anymore, and you're not doing what you liked to do a few weeks or months before, and you're just withdrawn. The other important thing is, when we think depression, a symptom is a weight change, a sudden loss of weight, which we commonly think in people, okay, somebody who's depressed might not be eating much. They are just because they don't want to eat, they don't feel like eating. But the other aspect of it that a lot of people do not realize or understand is, you may be eating too much. You may just be eating almost all the time, and which is not common for you. Or you may be eating things which you did not before, which would be not particularly considered as your normal diet, or more of the unhealthy foods that you would think. and and there's a sudden unexpected weight gain or a weight loss, and that is a symptom of depression. If somebody is not sleeping at all, insomnia is very common in depression. But at the same time, there's another aspect of hypersomnia, or sleeping too much nearly all the time. All you want to do is get up in the morning, and after an entire 8 to 10 hours of sleep, you get to sleep, you want to sleep more, you just don't feel rested, you want to sleep much, much more, and continue to just sleep throughout the day and not get out of bed. That would be something extreme, and that is something that is a symptom of depression. The other thing is very restlessness, or you're just not able to sit steady in a place, tossing from here and there, moving your legs and arms. With somebody is like, why are you so jittery or restless or just lethargic and not very slow to move, slow to do things, slow in getting and carrying out your daily activities. A task would normally take you an hour or two to complete, but you noticed the whole day is gone and you just were on one particular thing, not able to complete it. The other very important symptom is fatigue or feeling tired. This is something I see very commonly in my practice, more common in women than in men, but women do present, or for that aspect, even now men or children, adolescents, they present with something called as just chronic fatigue. They are tired all the time, and it is just the minimal activity that makes them tired. Somebody just went up and did a 30-minute walk and a little bit of more activity in the household, and they feel extremely tired to carry out their routine activities. And I see women complaining a lot about that in practice. And when we investigate, and first thing we want to look for is a multiple are other things which we will talk about later. But just experiencing extreme fatigue is not normal. If you were feeling fine a few weeks ago or months ago, or even say a year ago, and you have noticed in yourself that change, that you are just now not able to do that amount of work that you were before, and you're feeling extremely tired and lethargic throughout the day, then there may be something else underlying. Definitely, there are medical causes, but depression is a big factor that is there. And a feeling of being worthless or just inappropriate amount of guilt. Now, let me clarify. There is something called as, yes, normally we all feel guilty about not doing something, or after a while, everyone is able to cope up with it and just lay off that guilt away and move on. But when that guilt gets to the point where every time all you feel is that I did this and this was wrong, this was just, it's all about me, I'm just not capable of doing anything anymore, I am just not worthy of anything. I am not good enough. I'm just not good enough. Whatever I may do, it is not right. It doesn't come out to be the right way. And that guilt hampers you to carry out your routine activities. This feeling of being extremely worthless, or just this excessive guilt is just doing just too much harm to you from within, that you're not able to carry out your tasks in a day, and just sitting and doing nothing. The ability to concentrate is affected. Sometimes we're very, very forgetful through the day, and we all have too much to do in a day, even though we have list of tasks to complete. And many of us, mashallah, may be very planned and organized and write down our tasks and do things, and then you notice, well, I'm forgetting a lot, I am not able to finish this or complete things. And when somebody's talking to you, you are looking at them, but you're not there with them. You're watching television or you're watching something, and you are missing most important aspects of it. Or you start reading something, in the middle you notice that you're just lost, you are not able to focus, you're not able to concentrate on what you were doing, not able to complete a task that you were given, and just you're not able to make decisions quickly. That is a very that's also a symptom of depression, being very indecisive. No, lack of self-esteem. Almost every almost every day, people who have depression go through most or some of these symptoms intermittently, multiple times through the day. And the most important one, which most people do not want to talk about, and they don't want to even come out and discuss this with anybody, but I do want to put this out there that this is real. This is true. It happens. People do get suicidal thoughts or suicidal ideations or thoughts of hurting themselves, just to this extreme that they not necessarily they want to go ahead and do something to themselves at that point, but they would wish that this would not be like that, or they just wouldn't be living. They would wish they would be better off dead. Now, a lot of times, these 9 things that we just spoke about are all a part of screening tools that your doctor can use, and to ask you symptoms of depression. Now, a lot of us may not have a primary care doctor, or may not even go to a physician regularly for your annual checkup. One of the things I don't want to start off with is, whoever is listening, is to encourage you to first go have a physical every year. See a doctor every year, and just for a physical, a routine physical. You may not experience any of these things, you may not feel anything wrong, you may not be, but make it a habit to have your physicals every year, because an ounce of prevention is better than cure. It is way better than cure. If you take care of yourselves beforehand, you will notice how good, how healthy you can live, and you will live longer, inshallah, and healthier if you take care of yourselves early on. And one of the things that I, as a primary care, and most of the doctors out there would discuss with you is just go over things with you. And this is a part of our health questionnaires that we ask our patients at every visit. In our clinic, we do this every visit. Most of the clinics might do it at your annual physical or every 6 months, depending on what protocol the doctor follows. But given the current rates of depression in the United States, and is extreme, and it has increased to about a 40% of the total population that feels depressed after this post-COVID era. In the past 2 years, this has tremendously, which is almost a double of what we had seen in 2018, according to the statistics. And that mental health disorders have increased to that extent. They have doubled up in these past a couple of years. And we see more people coming now, though, and talking about it. But yet there is a lot that needs to be done to address this issue in the society, and especially the stigma around mental health, which I am glad as a community we are doing so much to create awareness of mental health today. And this is our step, and inshallah, may Allah put barakah in this, and we may have more of us being more aware and doing more towards this, to acknowledge each other and support each other and live more better. Because one of the things I do believe in, and one thing that is shown in centennials, those are people who live for 100 years and longer, are that they are not only physically healthy, but they are mentally and emotionally also very, very healthy. And that is very important. A balance between the physical health and emotional health is very important to be able to live better. And that is the holistic approach that now a lot of the providers are taking, so that we can improve our patients, not just their physical health, not just their diabetes and blood pressure and cholesterol, but also their overall well-being and their mental health. And that is one of the things. So when I was the last point that we were talking about, the recurrent thoughts, that is a very, if that is present, then that by itself is enough for me to diagnose somebody with depression in the clinic. And this is this is something that your doctor can do when you approach them, when you see them, and they can guide you from there how to go about and what to do. So for one of the things let's talk about is, when it comes to diabetes, it is easy for me to explain to my patient and say, okay, your numbers look like this. And this is why you have diabetes. You meet these criteria, and that is why you have diabetes. Your blood pressure is high today, you have a high blood pressure, your cholesterol looks like that. When I start talking to people about their depression, and after I've looked at their questions that they answered, sometimes some people do answer it honestly, and a lot of times I want to say that people do not even answer it honestly, just with the fear that the doctor might question them more, put them on medications, do something which they absolutely do not want. So let's start off by saying, let's be honest and let's answer these questions or these things. Looking at your own self, ask yourself these questions and be honest with yourself. And if you have any of these feelings, or if you know somebody who seems like that to you, just sit and talk to them about it. Because when we see this, and I approach my patient and I say, this is what I see, see that you have marked a lot of these on the higher side, and this looks like that, can we sit and talk about it? Initially I do get a response like, maybe, maybe not. A lot of people now, thankfully, are very much more open to discuss this, and there is no harm in discussing with your doctor. It is a very confidential information. Whenever you talk to your providers about this information, it is very confidential. They're going to keep it to themselves. You're not going to be labeled as something, and it is not going to be disclosed to anybody, even not even to your family members if you do not want. We will not do that. That is one thing I will, for the patient confidentiality, and your all the information is very, very confidential. So you can openly talk to your doctors about this and discuss with them what you feel. That is very important to start off with. And when you are approaching them, be honest and just start off with whatever you feel wherever you are. So when we were talking about the diabetes and all of that, it is easy to talk about and say, okay, here, this is where you are, you need to bring your number down this much, let's do this and this, and start these things. But when it comes to the depression, again, thankfully now we have a lot of ways to assess this, a lot of different proven, research proven methods, that when we ask these questionnaires, they may take some time, but yes, there is research behind them. And this is not just a pen and paper question. What there is something actually going on inside the body that not many of us can understand. And we know from the years and the studies that have shown that depression actually is multifactorial. It is linked, it can be linked to a variety of other aspects of it. Sometimes it could just be genetics, because somebody in your, it is in your genes that, if you've had parents, grandparents, or someone that has always just been depressed and been like that, it is just that you have it. And there were studies which had actually shown that girls and in their teenage years, of women whose mothers were more depressed were found to be more depressed later on in their lives. And there is a genetic link to it. So don't think that this is all just made up and it's a disease of the Western world, and it does not exist. It does not really exist, but it really does. And then there are actually structural changes that happen in your brain. So when we look at functional MRIs, what we call the MRIs, which look at the functioning of the brain, we do see certain things in people who are depressed compared to others. There are certain centers in your brain, especially the hypo and the hippocampus, which is the amygdala, the hypothalamus. These are structures within your brain that are responsible for this, the feelings and the emotions. And the hippocampus plays a very important part in that, and as much as also your pituitary. The other part is your prefrontal cortex, which has the emotional regulation, which is a great important part of the emotional regulation. We see that these structures are actually smaller in size in people who are depressed in the functional MRIs that were done. So there is actually a process that is there. This is not just something that is a disease of the Western world and then there is nothing to think about when somebody is feeling that way. They are actually going through some things. There is a problem within themselves. Their neurochemicals inside their brain are not exactly the way it is in a person who's not depressed. And a part of it, there are three basic things. And a lot of us now, with media and with everything being so information being out there, we do know a lot about these neurotransmitters, which we call monoamines in the medical literature, along with other certain other neurochemicals, which I don't want to go in excessive amount of detail, but especially the three monoamines, which we call serotonin, norepinephrine, and dopamine. Initially, there was a thought that there is a decrease in these monoamines, but there's more of a complex thing going on inside your brain that really causes this problem. And definitely, there is a decrease in these neurotransmitters. And that is one of the reasons why the person who is depressed is not able to cope up and just function as anybody else is, because they are just not having that amount of neurotransmitters in their brain that they really needed to. And these are, I will talk a little more about how these neurotransmitters, we can bring about a little change with them, with just changing certain things in your lifestyle also. So that's another thing. Children, when it comes to children and adolescents, when they were preterms, or they are low birth weight, or they've had other problems, and those children are actually more likely to be depressed than normal term babies. And there are other um, this is nature, but there is definitely a part of the nurture which plays a part in it. When we say nurture, it is your environmental factors, the multiple things around you, the daily stresses of just life. Um, it could be your from work to your relationships to, and just carrying out, fulfilling your tasks of daily life, parenting, and different stresses that you have been through. Those can actually lead to problems. Stress by itself causes release of cortisol and the steroid in your body. And when the stress causes this excess cortisol, this cortisol actually goes back up to your brain, and it decreases the functioning of the hippocampus and your brain, and it really is not able to react the way it used to. So reducing stress is the primary thing that everybody talks about. And when we talk about stress, it is it's just unavoidable. In today's life, we all are busy with tons of other things. And now, especially in this past 2 years, we have been hit by another excessive stressor of COVID, which the uncertainty around it has hit so many of us that we do not know what is going to the future is not known. So that's an additional added stressor. Children are at home, people are working from home, family relationships are more tested in this time, rather, because we are tested with our skills much more in these past 2 years than ever about all these things. And we see people lose their patients more commonly now than ever. And definitely this, and everything that's going around in the world, not to forget that, because that also impacts our daily life. Even though we're not there, but we listen to the news that things that are happening in the Middle East or anywhere else in the world, it is impacting our own health, our own mental health here, because we're thinking about all of that. Or the generation that is here, there may be people living in different countries. You have relatives back home, and you're thinking, what is going on there? Because many of us have not been able to travel back home with all the restrictions of COVID. We are isolated in our homes, and we are not able to communicate with people, go out, do things as we used to. And thankfully, it has improved from the past few years, but again, we are hit by a new rise in cases, putting us back in that lockdown situation that we were in before and restricting our activities back again. And we're probably likely going to see a rise in mental health disorders just by themselves. Now, this is to talk about depression. There is another aspect of it, and it can be mixed with a lot of other factors like anxiety. And not necessarily anxiety will mean that you are just on feeling that nervousness, but you could be actually feeling it within your body. And your body may be presenting differently with aches, with pains, with a very common symptom to see in people who have either depression or anxiety is abdominal pain, which has got no other reason. We investigate people who come with pain, and they have just pain after eating, pain after doing certain things, and then you run a battery of tests, you investigate to do endoscopies, everything, send them to the specialist, the gastroenterologist, and they send them back. But now in the medical literature, we know that what we actually do for these people is ask them to reduce their stress, change their way of eating, and ask them to take medications which are nothing but antidepressants. So there has been a link between the gut and how you feel. And this is a very upcoming field. It would take a complete different topic to a day to talk about, called gut and psychology. And that is really something that is of interest, and much more things are out there to read about that and come up. But we will talk about it a little bit just today. So after this, I do want to say that if you are experiencing these symptoms, after talking to your doctor, definitely they will run some tests. That's what we do commonly. I do in my practice. I want to look at thyroid. I want to look at other, just if you're feeling having anemia, having any kind of other medical issues, we would look at that first, rule them out, treat them, and then see how you would feel. But if you meet these criteria, and your doctor or as a provider, I feel that you're depressed, usually that I don't get much time to talk to my patients and sit and just counsel them and talk to them. So one of the things that we do after this is they offer different paths of treatment. And I don't know, for reasons I have seen, patients, when I offer them therapy, they outright they're not more acceptable. Whereas I've seen my patients, especially the Muslim population, more acceptable to medications and pharmacotherapy than they are to therapy, just psychotherapy or counseling or talking. And I did want to just talk a little bit about that, because as a counselor, they are certified and trained in this, and they're psychologists who have studied the various ways and methods to improve your mental health, and just even diagnose you and help you out, help you with the coping skills that are needed for that. And they can spend more time with you than your doctor can, and for about 45 minutes to an hour every time, and they will talk to you about the different ways that you can help yourself. Because when you have come to the terms already that yes, there is something going on inside and you need help, they will sit and talk to you about this, and there are various ways that they can discuss that with you. What we call cognitive and behavioral therapy. It includes a variety of just ways to treat our own selves and teach our brains, because our brain is very dynamic. it wants to learn, it does want to change, and it is possible to change. No matter what phase of life you are in, no matter how old you are, you you can change yourself. And this is something I tell my patients when they are even in the 70s and they've been smoking for 50 years. And when I ask them, how can I help you quit? They're like, I've been smoking all these years. How can you help me quit now? I'm like, it's not too late. It is never too late. So it is never too late to start off this. And when they will a change, and your brain has got memory, it will learn through this process. The more you do this exercise, the more you do it with a plan, it helps you better. The more you write it down and the more you go to the therapist, talk to them, seek the ways how to change, it is more likely that you're going to change. And that is what we know from the literature, is that the change comes once you start off. So there are various modalities of this kind of therapy that they offer you, from just talking to you, like interpersonal psychotherapy, where they would just talk and just ask you. Some people just listen. Some therapists just do not even intervene. They just listen to the patients, and sometimes that's all you need, is to vent out and listen um, to your own self. And you want someone to listen to you and acknowledge and be empathetic towards you, because we all want a non-judgmental approach towards our feelings. No matter where we are, we want to be acknowledged that yes, we are feeling this, and this is what where we are. And sometimes that's all they do, is just hear you out. Now that may be an approach that works for some, it may not work for you. I have some of my patients who come back and tell me, I don't want to go because that person doesn't help me in any way. They just listen to me. So that doesn't mean that you just stop doing that. It may mean you want to do something else, because that does one size does not fit all. You have to just change the way you approach it, and you may need something different. There is also a psychodynamic therapy where they help you develop an insight to know more about your own self. And that is very important in dealing with any mental health condition, is to know your own self better. Because when we react to certain things, it could just be the past experiences that we've had, whether they are our childhood experiences or relationships or anything that you've had in the past. It actually has an impact on you unconsciously that you have not realized. The way you are acting right now, maybe just because this is the way your mother did or your father did, or somebody in your life you saw did, or some past experience that happened to you, and you just do not even realize that. And when you go and talk to the therapist or a counselor or somebody else, you start noticing and uncovering those aspects of your life, and start helping yourself better with that, and with treating that. And there is also something what is motivational interviewing, which impacts a lot of people, even if you have other medical conditions, not just depression. And this is very common to see people who have other medical issues like diabetes, high blood pressure, obesity, or heart conditions, lung disorders, anything that is just a chronic issue. They they have more depression associated with it, and they just don't get better. When they're not getting better, or when you know somebody who's just not getting better, um, there is something going on underneath. Every diabetic, I'm sure, knows by now that they're not what they're supposed to eat and what they're not supposed to eat. When I ask my patients who are uncontrolled, it's like, what do you think happened here? And they're like, I know I did this. And so this gives them the accountability. They know what they did wrong, and then they want to bring about that change. So by motivational interviewing, what we mean is we ask them, where are you on a scale of 1 to 10 to bring about this change? How motivated are you to start living differently or doing things differently? If somebody says, I'm just not there yet, then I would not push the button more. I would say, okay, whenever you're ready, you come back and talk to me. But this is why I want this X, Y, and Z, and I will leave it there. Because that person's not there yet, I will again encourage them at the next visit and keep doing that. But if you know of somebody, including your own people around you, that you want to bring about a change in them, you have to motivate them first. You have to have some form of motivation to be able to do that, so that you can improve. If you are motivated on a scale of 1 to 10, you're 10 on 10 to improve, then it is very easy for somebody to help you than somebody who's, just at 1 or 2, just starting off. And so that is where these kind of modalities come in. Now, definitely as a doctor, medications are one of the tools we use. And these medications have a lot of taboo and a lot of stigma attached to them. When I offer somebody medications, some people very easily accept it. They're willing to take it. They're like, okay, give me a pill to treat this, which is good. But again, remember, depression and mental health disorders, treating them along with therapy is one of the best ways of combining the both, is shown to be more effective than a single mode of therapy. But definitely medications are better than placebo. So they're better than taking nothing. And some people are at that stage where they need medications. I would like to share a personal case without disclosing much of information. Is somebody who came to me who is like, I'm just trying everything. And they had family members along with them. And they were like, I just don't know. I feel like that all the time. I just don't feel like doing anything. And the family kept insisting, it's like, you need to make more dua. You just need to make more, you need to improve on your own spiritual aspect. Then this will get better. Certainly, I do agree that, like, other depression is known to be in our faith in Islam a disorder, a disease of the heart. And definitely there is something that they need spiritually. But sometimes for them to get there, only to start off and connect with Allah back, they need somebody to take them out of there. And they may need a little bit of medication to just start off, and they will just go on from there. Because the person I saw, they were just feeling like that. And it was difficult to convince them initially, because they think that once we start medication, this is a lifelong medication, and they may have to take it, may not. I cannot certainly tell you that it depends. It's case to case basis what you are presenting with. It does not mean that you are going to be addicted to these medications. There are more different, safer medications, less addictive. They are long term that you can take now available. And we can start very low, go slow, and see how you do. Because some people just need that so that they can come out and start doing the things that they needed to do. And once they are there, then 6 months at least we give them on the medications. And after that, we would just we could either try to wean them off or give them a few more months or years, depending on how they're doing. And keep reevaluating. Go back to your doctors, talk to them about that, and see. And there are multiple other options, in the medical, as far as the medications go now, that you can talk about. And not necessarily you will have side effects to them, or they are side effects to certain ones of them. But give them 2-3 weeks, let them see how you do with them, and then go back to your doctor, revisit, and see how you're doing. If you need something else, you may need to be changed. You may actually need to try different things before you find out something that works. And this is quite frustrating for a lot of the patients and a lot of people out there, because they don't know. They're like, this is not working for me, this is just not right. But you may actually need more time before we can do that. And something very interesting now is pharmacogenomics, which we can actually see from your genetics, which of these would actually be better suited for you if we start off on medications. Whether you will be doing better on one or the other. And that is available with some of the psychiatrists. We don't do it, I don't do it in my practice right now, but that is something that is very interesting and very good to keep a look at and see. And last, I would like to touch on very important aspect, which is nutrition. Which is one of my favorite things to even talk to my patients about, because our people who are depressed have very poor eating patterns. They have poor appetite. They skip multiple meals, and there is a desire to eat sweet things. And this is one of the poor food choices are common. This is just because that the sweet elevates them for some time. They feel better, and then they again crash down. So as a mood elevator, they go to that and then they again crash down. There are links between nutritional deficiencies, specifically omega fatty acids, B vitamins, certain minerals, amino acids like tryptophan, and phenylalanines. They are linked to the precursors of these they are actually the precursors of these neurotransmitters. So whenever these things are absent or they're missing from your diet, and for years together they have to be missing from the diet, that you will see these things, especially with the changing trends now with eating out more commonly, the fast foods that we eat, um, the foods that are available in the market, the processed foods that we eat, they lack a lot of these nutrients that we really need to be able to feel better. When you eat the rainbow, when you eat the multiple colors that are available, that Allah subhanahu wa ta'ala has made, it is just incredible how good it will make you feel. But again, somebody who's depressed might just not want to do that, because all they want to do is just eat what they feel like eating, that makes them feel better, and go back again to that. Limiting your carbohydrates is not good either, because carbs are important. They are required for, as we discussed, the neurotransmitters. The tryptophan actually, there is a precursor. The glucose is needed to be able to make those and form the neurochemicals that are needed. So it is important to eat your carbs, but picking low glycemic index foods like whole grains is much more beneficial, and fruits and vegetables that are naturally sweet are more better than just plain sugar by itself, or breads, or things which are processed carbohydrates. Those carbohydrates are not the ones that will help you keep a stable mood for a longer time, whereas something that has got a low glycemic index will keep your mood very stable. And a lot of people notice that when they eat too much of sugar here and there, they feel better for a little bit, and then they start feeling bad and crash suddenly. Vitamin D has a very big role. Your doctor can check your vitamin D level. Some physicians do check other vitamins also, just the B complex vitamins, and you can find out what those are. But for most part, low vitamin D is associated with higher rates of depression, and treating the patients along with all these other things is important to heal and cure their heal them better and faster. The other thing is exercise, which is a great impact on these on depression and mental health, because this increases your tryptophan and norepinephrine levels, and it decreases your cortisol, the stress that is there in everyday life. Just with 30 minutes of exercise every day, it could just be walking, it could just be going out, spending some time in nature, and that will help build these neurochemicals back again, and help recover better from depression than just plain therapy or medications by themselves. And there are other forms of exercises which we, definitely that requires more of guidance, like resistance training, swimming, cycling. If you know one of those, that's excellent. You can do that. Then mind exercises, the body and mind exercises, forming a routine of performing something in the morning and evening, which it could just be sitting grounded for 10 minutes in the morning and just thinking and or journaling about yourself and reading and doing dhikr in the morning or evening, just but connecting and thinking about what you're doing instead of having your mind everywhere else, just sitting in a place and making a habit of doing um, 10 minutes of dhikr in the morning or in the evening, or just sitting and doing relaxation and deep breathing exercises, and or even yoga if some people are familiar with that. That is very helpful. Meditation in the literature has shown to be helpful, and we as Muslims know we meditate 5 times in a day. Our salah is it is the meditation we have every day, and Allah subhanahu wa ta'ala has granted us that. But sometimes people who are just extremely not there and depressed, anxious, just having other disorders, might not be able to focus, and that is the reason why they're losing that focus in their salah, and they might need that additional help to get back to that too. So doing that is seeking an overall holistic treatment for everything might put you back. Spiritual will help you not only just heal the physical and mental health, but spiritual health will improve also with just doing this. And we know spiritual health is a very important part of our lives. That is, as Muslims, as we we are, alhamdulillah, we are granted by with ways that we can we are protected from a lot of other things that we see normally, like substance use and alcohol, which unfortunately now in the youth we do see a rise even in the Muslim youth. So those are things that are coming up, but some part, the most important, it is we are protected with what we do in by our religious practice. So and one last thing I would like to also just leave there, and I did discuss with Dr. Khan, who is leading this, the psychiatrist who is leading this mental health awareness, that we would like to put up on the NAMCC website a link to resources, which resources towards mental health providers, psychiatrists, counselors, therapists who are available in the community, including the Muslim mental health providers and therapists. Because one of the things I do see a lot of the patients ask is, I want somebody who understands our faith, just not give me the treatment just without understanding. But those can be we will work on making it available to the community, and she actually has something, so hopefully soon we can put that up. But there is a suicide prevention helpline, and there is it is 800 talk, and there is also just 800 suicide. For somebody whom you know who is really in that dark corner and needs that help, that is very, very important. And definitely calling the 911 and emergency services and getting evaluated is important. But that is there to just go and talk to. They will not discuss anything with you. They will keep your information confidential, number one. Again, that does not mean that when you talk to them about how you feel, that they're just going to come grab you from home and put you in a facility. That's not how this works. It is voluntary, so it has to be through your free will that they will do something, unless we find an immediate threat involved there. But otherwise, it is just to talk to and go over what is going on and just kind of help you um, break the strings and just put those together and see what is going on and provide more help towards overall health and well-being. And with that, I am I conclude my talk. If there is anything else that, if there are questions, I am more open to talk and discuss about that. Anyone would like to discuss something here, something specific? I believe I am able to see the chat. So you can type, you can unmute, or you can talk.
I think they don't have option to talk, but they can type in the messages in the chat.
Okay. So I can look at the chat and see if we have any other. I see a raised hand.
Just can you type in your question here? Okay, so there is one in the question and answer. I can ask you the question. Question is how to help a minor who is helping other friend expressing suicidal thoughts.
That is an excellent question. So how to help a minor who is helping other friends expressing suicidal thoughts? So here, if I'm able to understand this correct, is that somebody whose friends are expressing to them that they are not feeling, they are suicidal. One of the things I would like to say in that case is that hear them out, but encourage the friend or the child to talk to their parents. And because in a minor, the parents are very important to talk to take them to the doctors and seek appropriate help, and to just encourage them, because we are not able to do anything for them unless they go ahead and their parents are willing to take them for treatment. I would keep reinforcing it every time that that person brings up that thought, is please, please, this this is possible. I hear you. You're going through this. This is something that happens to a lot of people, because first thing they need is the acknowledgement. And once they get that, then encouraging them to talk to their parents, or you talking to their parents, and telling them that this is what has been expressed to us, and please seek appropriate help and counseling and therapy. And just, if the minor is able to talk to their doctors by themselves, that is something that they should also start doing, because when they come to the physician, as a physician, we definitely are required to hear the child by themselves, and then provide them with appropriate help that is needed. And if we feel that the parents are not doing that, then we may even go to the extent that we may go against the parents and offer them the treatment too. It would all depend on what the case looks like, because if it comes to the point that they're having the suicidal thoughts, then that would mean that they could do that. So just encouraging them to talk, or even calling one of these helpline numbers is very good, because you could just provide them with this number, or the friend with this number, and say, why don't you go ahead and talk to them, and again tell them that they're not going to do anything right now. They're just going to talk to you. They're just going to go ahead and talk and encourage you to do um, seek the treatment, and eventually hoping that the parents will come to terms with this and get help for the child, because that is very important. And then the questions after that, I hope that helps. That's not much, unfortunately. In when it comes to treatment, voluntarily, that is voluntary involvement is very important from the patient themselves, and that is what we need to be able to treat. I myself have had people whom I've referred to where I felt like they really were a danger to themselves, and sometimes there is a complete detailed evaluation and they would just be monitored after that. So that's unfortunately there, but they have to be voluntarily seeking, and their family has to be voluntarily seeking help. And I hope that they are hearing and more aware of this and can seek help. And there is more on nutrition and food. What food improves mental health? Children feeling down, how do we manage self negative thoughts? um, what food improves mental health? And definitely eating um, more fruits, more vegetables, less processed foods. If you can eliminate the processed foods, that would be a wonderful thing to do. I encourage my patients to do that, but make sure that if you're eating different colors through the day, and include a lot of fruits and vegetables instead of the processed sugars and the cookies and candies, and just cooking your meals and having meals with your children together is something that really really helps. Unfortunately, children, who are suffering from these issues by themselves do not like to eat. They're picky. They have issues with eating also. So it is very challenging to sometimes even give them the healthy foods, but not bringing the unhealthy foods in the house itself, or keeping routines and patterns which will help children eat right is very, very helpful, because um, they will try to seek to eat the unhealthy foods. How do we manage self negative talk? That is for children. I would think that the therapy is one of the best ways to start off with. But the child psychiatrist would be more of a help in that case. But the self negative talk, even in adults, as we help them, is to teach them with writing down and forming like a gratitude journal, or something like that is one of the things that is very very helpful, is writing a gratitude journal towards them, and positive reinforcement, lots and lots of positive reinforcement with anything that is good. Just positive, just telling them that this is not how you do this, this is what we do, this is how we think, this is, or maybe just encouraging them, because we want to have them come up with that idea. When a child tells you that, oh, I just think that I am extremely this or that, hear them out without giving them a judgment, without telling them that this, oh, no, 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 that's not right. Why would you think that? Why would you think that? Or why would you do that? Why, how does that? That's not you. That is your judgment of them. But what they are coming and telling you, the self-negative talk, or any feeling that somebody is expressing to you, is first needs to be acknowledged. It needs to be acknowledged first, and say, okay, you are feeling that way, but tell me, why do you feel that way? And then you can tease it out from there, and then you can give them slowly working on the tools on how they can improve their own thinking in that direction, and that will be very very helpful to them. And there are various ways of therapy. There is something called as a parent child integrated therapy. There is play therapy for children that is there now, and it just involves a few hours of just playing with you being there and your children. And they would when they do the play therapy, they just go ahead and teach you and the child the ways how to improve these self-negative talks and the negative feelings that they have. I hope that answers the question.
Jazakallah khair for the great session. This was very informative, and I think it will help a lot of our families to go over this recording and find the ways, connect with the primary care, and find the solutions to the problems at hand. And more than that, explore what all resources that they have at hand, right? There are a lot of resources that are available, but we don't know,
Exactly.
we're not aware of it. And I think what you touched on are eye openers for us. We just focus on one line of action that may not be a standard one, which has been tried or tested and seemed to have worked.
Absolutely, because this is multifactorial. It is not, the solution is not just one thing. The solution is a lot of things together. And we may not be able to do that all together. Again, progress is what we're looking at, not to completely treat and heal. When I see my patient score improve from a 20 to a 18, I tell them that's progress. That is what I'm looking at. And they say, I still feel the same. That's okay. We will keep working on it. We will keep doing this, and we're going in the right direction. That's all that matters.
Right. So Jazakallah khair, and inshallah we will post this recording on our YouTube channel, and also the resources what Nudrat was mentioning from Dr. Afshan Khan are soon coming. They're work in progress on our website. So you can look at that. And as the doctors come on this panel, we'll list them in our businesses and services on our website. So you can go to our website, look for services, and there is a section called businesses and services where we have listed all the professionals that have come visited on here, and also the other businesses that are in town that can be of help to our community.
Inshallah, inshallah. Definitely we will look at that, inshallah.
Jazakallah khair, and
Wayakum.
thank you for your time, everyone. Assalamu alaikum.
Assalamu alaikum, everyone, and thank you again for attending.